Hey, everybody, this is Eric Mishi, SAVE Executive Director, Suicide Awareness, Voices of Education. And we have had a lot of incredible conversations this week during Suicide Prevention Awareness Week and Suicide Prevention Awareness Month, and um, all the way from conversations with Allison Ivy, who's with the Eating Disorders Coalition, where we talked about Kids Online Safety Act and trying to get that across the finish line. We had conversations with board members of SAVE, who are suicide loss survivors, folks that have helped to lead the organization forward over the years, who are part of grief support groups. We've talked about veteran suicide prevention. A lot of conversations this week, a lot of conversations with folks from working on issues related to suicide prevention at a local, state, national level. We even had a chance to chat with our good friends with Save and Raid, which is a streaming game fundraising, suicide awareness, all of those kind of things. And I know that my friend Maddie and Bogle, if they're watching this, they'll send me a message and say, you got the description wrong again. But we talked about the power of the streaming and gaming community to help raise awareness about suicide and build that community. We're going to end today's series of conversations talking about suicide prevention barriers on public structures. And it's a topic that is important to SAVE because it's something we've been working on since January, when we got a phone call from our next guest here, MJ. And we're going to chat with MJ a little bit about what this issue is all about, why it matters, why it's important to her, and to kind of talk about the need that we have here in Minnesota and across the country to address this issue of how do we make public structures safe for everyone in a way that makes sense, that we can kind of put our arms around and work together and make happen. So with that, MJ, thanks for joining us today.
Hello, thank you for having me.
Well, thanks to have you here. So let's talk about MJ. So how did we get to this place where you and I are talking about suicide prevention barriers and deterrence?
All right, well, it all started actually in November when my daughter Kayla, at age 29, drove from her house in Shakopee to a bridge location and chose death by suicide. I'll even preface this by saying I've lost another child before Kayla. That was something medical, therefore expected. My son Aaron died back in 2015 from cancer, appendix cancer specifically. We had time to prepare for that, given the fact that we were, I will say, blessed at that time with time to have with him and just mentally and physically prepare ourselves for the outcome that he was going to have. Totally unprepared with the whirlwind that our lives undertook when Kayla chose death by suicide at her location on a bridge. Kayla at 29, 2 small kids. We all thought things were going very well for her in her life at that time. I have 4 other still living children, and in conversations with them as well, with her friends and other family, nobody picked up on the fact that she was hiding something from us. So after contacting my sister and Brittany Sensor, who is part of the SAVE organization, we got in touch with Eric here at SAVE and formed Kayla's Hope Team. And since then, we've been on a journey of committing to getting short-term and long-term barriers placed on bridge places so that we can prevent this from happening to any other families. We've done some work at the Capitol, the state legislative areas. We lobbied for the U of M specifically to get money for bridges, safety barriers, and other deterrents. That unfortunately fell through and was put to a stop when they didn't pass that bonding bill, but we're still moving forward with communications with Hennepin County and the U of M and our state legislative groups.
So thank you for sharing that. And obviously, Kayla's loss is a loss to her family, it's a loss to the community. And it's really a loss to all of us. And as we have worked together and will continue to work together on this issue, why does it matter to you?
It matters to me because when you take a look at bridges in particular, there's a lot of bridges that don't have what they need to protect our public in general, students, young kids, older people. And at certain locations, when you hear of, that 2 to 5 people choose death by suicide because of the location that it's at, it's quite alarming. And then you begin to realize that, wow, something needs to be done. And the fact that things haven't gotten done, even though our state people have been told repetitively that we need things in place, I realized that I needed to help move this forward. And thankfully with SAVE and the people on Kayla's Hope team, we've been able to slowly move things forward, and we're going to continue until we get things done to protect everybody. And that's part of that is Kayla's Hope, helping others and protecting everyone.
Yeah, and it's really important for us, during this call today or during this conversation, we're not going to mention the specific name of the bridge and location, but I mean, we can say this is that, this is a bridge that for 40 years has been something that is a significant public health problem. It's something where we believe that with relatively minimal resources in the short term, we can do some prevention and deterrent measures on this public structure to help protect and save lives. And so as we continue to have these conversations with these different bodies that have jurisdiction over all or part of this bridge, it's really important for us to talk about why barriers and deterrents matter and why they work. And so, one of the things, MJ, when we were up at the Capitol working with the University of Minnesota, advocating on their behalf that there be money appropriated in the bonding bill to make sure that there was a permanent solution to this particular structure, we talked a lot about the protective factors of barriers and deterrents. The notion that signage, lighting, these kind of things, they aren't principal means of protection. They supplement and support barriers and deterrents, but we know for a fact that barriers make a difference and make it in terms of saving lives. And we look at the High Bridge in the city of St. Paul, where in 2017 they redesigned and rebuilt that bridge, and in doing so installed barriers on the railings that really have become life-saving measures on that bridge. All of us are familiar with conversations around the Golden Gate Bridge for decades and decades and decades. And there's now barriers and there's nets and there's an entire very complex structure, all designed to help mitigate suicide at this bridge. And so, as we talk to legislators, I think that they were shocked that this issue even existed. And I think we're particularly moved by the story that you shared that, had these kind of protective measures been in place, there's a good chance that there would have been an opportunity to save Kayla. I think, why don't you share with folks a little bit of these conversations that we had with different legislators? We don't have to mention which specific ones, but I mean, ultimately, because of the work that you helped lead, we were successful in supporting the university in getting the $15 million they were looking for in both the House and Senate version of the bonding bill. Mm-hmm. But for the politics at the end of the legislative session, with this bill not getting a vote, those funds would have been there.
Correct.
And we'll come back to that in a little bit, because even having those funds there still doesn't address the short-term needs to protect people. But why don't you share with folks kind of what your message was to legislators, and generally kind of what was their response in those conversations?
Well, the legislators that I did directly speak to were very open to getting these short-term and long-term barriers and other deterrents up, because the more you talk about things, the more I'm beginning to realize that everybody knows somebody who is struggling with some sort of mental health crisis or affliction. And whether it be a cousin or an aunt or a brother or a sister, somebody knows somebody who at some point in time does or has needed help. And because of these conversations, and knowing that they have small kids or that relative, or they have somebody going off to college, or they have that elderly relative that has actually chosen death by suicide, it did hit home with many of those at the Capitol in those conversations. So again, they were very open and quite alarmed by the fact that as you said, Eric, we haven't had these protective railings in place. And when you look at places like the St. Paul High Bridge and how effective that was, just why hasn't it been all the way around on the state and on all the other bridges and structures that we have?
Yeah, and I was struck by the fact that this was a really bipartisan response, right? This was Democrats and Republicans. This wasn't just one party or the other party. It was liberals and conservatives. Time and time again, they came back and said, we got to get this done. We got to make this happen. And, again, unfortunately, the bonding bill didn't pass. But, I think it's important for folks to realize that even if that bill had passed, and that's kind of, excuse me, that's kind of the situation we're in now. Even if that bill had passed, there was going to be a gap of 2 to 3 years between the time that the bonds were issued, the construction started and was done, which was going to require short-term solutions on this particular structure to make sure that we're protecting people in the short term. And so we've kind of laid out 3 options, right, that we believe are credible options. One is to install a temporary suicide prevention barrier, which we still believe could be something as simple as a durable chain link fence that might be attached to the existing railings, which is not only cost effective but easy to do. The second option is to redirect traffic away from the exterior side of this particular structure and route traffic to the center. And then we've even said if you're not willing and you can't figure out how to do either one of these, what we believe to be very doable, very cost-effective solutions, then shut the bridge down until you can make it safe for people. And that seems, it really kind of seems pretty simple, doesn't it?
To us, absolutely. You think of all the safeguards we put into place when our kids are young on the playgrounds and at your home when your kids are babies, and our streets and other parks. I just feel that on a whole, our state and federal groups, they forgot about what to do with the bridges. And I believe there was a story just recently, John Bon Jovi.
Yes.
He just rescued somebody off a bridge location in Tennessee. So it's needed not just here in our state, it's needed all over. These bridges, there needs to be something done about them.
Yeah. In Congress, Congressman Don Byers has a bill, I believe it's called the Suicide Barriers Protection Act, something along that line, which would direct the federal government, the Department of Transportation, to make funding available for communities across the country, grant funds available to address this issue. And what we do know is that there are other colleges and universities across the country where they have taken measures and steps to protect their students, protect the public, by addressing the challenges of public structures, to make sure that they've got these barriers and deterrents, and they seem to be able to figure out how to do this. in a way that, as you know, we're struggling to try to get a consensus here on something that I think everybody agrees we got to do. Now it's a matter of just getting it done.
Correct. And I know there are groups out there that are willing to step forward and help put things up once we get to that point and we get that permission. We've been approached by groups who have said that they will help with the funding of this. So we know it can be done. It's with the commitment, we just need the commitment from the other groups to just say, let's move this all forward.
Yeah. I spent many years in government and politics, and I will say that, there's a frustration here that, we've got a consensus that we got to deal with this. We got a consensus. We got to get we got to put these protective measures in place. And yet you would think that we're trying to kind of send a human being to Mars here. And that's really not what we're trying to do. What we're really trying to do is figure out a reasonable way, a cost-effective way to protect the public health at a time when we certainly have the opportunity to do it. You've got private sector partners, you've got nonprofit partners who have said, we'll step in. If the issue is money, we'll help, we'll find the money. If the issue is resources, we'll find the resources. If the issue is materials and labor, we'll find all those things. And so it's been a long journey for us. We still have work, obviously, to do, and we're going to continue to stay focused on that work to make sure that this happens. The need to kind of make sure people are aware of what the implications are of not doing something are really pretty severe, and really that's the piece that I think we're all frustrated by, which is that it's all avoidable, right? We can deal with this issue. And again, I think we've had a really good, positive working relationship throughout the legislative session with the University of Minnesota. Obviously, we were their biggest advocates and allies in helping to advocate for the money they were looking for this particular project. And I think we were all really thrilled that we were able to help them be successful in securing those funds. I think the initial kind of conversations that we had with, the leadership at Hennepin County was, we're going to figure this out. We're going to make this happen. And I think we're all cautiously optimistic that they're committed to that course of action. And so, as we continue this work, I think it's also important for us to share that, this is a part of a larger concept called lethal means safety, right? It's about protecting people on public structures. It's about how do you address the issue of providing safety, in securing firearms, not about taking them away, not talking about restricting people's rights here, but to provide, we share gun locks and trigger locks for free, so that if you believe that there's, someone at risk in your household, you've got those tools. And so there's a whole body of work about lethal means safety, which ultimately is going to be, Kayla's Hope becomes the umbrella for that entire effort. And so, as you have been involved with this, what are the things that you would encourage others, the community that wants to support this? What are the kind of things that you would encourage them to be mindful of? And what has been the most kind of positive thing that's come out of what really is tough to find much positive out of? But as you've thought about this and as you've worked on this, what has been some of the most positive pieces of this work that you've been involved with?
I'll go back to what you said, what can I encourage people to do? I strongly encourage people throughout the state to talk to their state, local, and state representatives and just continue the conversations on why they need to produce the funding that we need for these long-term and short-term barriers, just not on the bridge where Kayla chose death by suicide, but on other bridges throughout the state. And I encourage them to be comfortable with checking in with people and making sure they're okay, and increasing their education on what they know and how to help when they know of somebody in crisis, and to call 988 when they have some, that even a minute concern about a loved one. Give them a call and check in. Education is very important for all age groups, kids, your teenagers, your college students. We all need to do more with just being more mindful of where everybody is at that we have in our life, and continue to look out for our friends, our family, our coworkers, neighbors. And then the second part, the positive thing I can take away from this is, I'll just say on a personal note, my coworkers, I work at Fairview Southdale Hospital, and just in the openness that I've had with conversations with coworkers and my team of doctors and other ancillary departments, we're all talking about it now. It's not that taboo word anymore. We're all doing more check-ins, and I think that's what society on a whole needs to do. Is they need to not be so afraid to say the word, but to actually say it, be okay with saying it, and be okay with reaching out and extending a hand, even if there isn't a need. Check in.
It's all really important advice. You and I come from big families. You come from one nearly twice as big as my family. Both come, and these conversations about suicide with people that you love is tough enough, right? Is how do you have a conversation with somebody and ask them, are you thinking about dying by suicide? That's a tough conversation to have with people that you're very close to, right? But it's a conversation that we got to have. And it's one where you got to ask those that you care about, right? Are you thinking about hurting yourself? Are you thinking about killing yourself? And again, even saying those words can make the hair on the back of your neck stand up. But the benefit of having those conversations is opening the door for those who may be struggling to be able to say to you, yes, I need help.
Right.
And that's society for a long time has discouraged that kind of open conversation and dialogue. And there's specific demographics where, if you're a guy, right, you don't want to talk about your emotions, you don't want to share those things. And just think of the opportunity that each one of us has to help save a life if we're just willing to have that conversation.
Correct. And I 100% agree. We do our own suicidal risk assessments here when patients come into the hospitals. And, it was a learning curve for us to even have those comfortable conversations. But it's getting easier, more easy as, as society on a whole becomes more accepting of the fact that, yes, we do indeed need to have these conversations, and we need them because lives are precious all the way around, everybody's life.
Yeah, absolutely. So how do you look at this as a mom, as a grandma, right? In terms of what is it we named this effort Kayla's Hope, helping others, protecting everyone. How we created that, how that came about was really important to you in terms of what we called this effort. And, as you think about Kayla, whose 30th birthday would have been this past August.
Correct.
Right? What do you think she would want people to know about her? And what do you want people to know about Kayla?
That's a very good question. I chose Kayla's hope in the way that I did because Kayla was the person who watched out for everybody. And she would be the first one to help somebody else before she helped herself. And emotionally, she was the listener. I have your back. Come to me. Come talk to me. But I think in obviously the long look at things, she did it because she couldn't ask for help herself. And always the first one to dive in and get things done. But I think just her anxiety with being able to share where she was at personally with her life. So in choosing Kayla's hope, I just my plan was to just make sure people were okay, that it's okay to speak up and say you're not okay. And in that way, not just for Kayla helping herself, but just helping others and protecting everyone with, feeling emotionally safe and transparent and being okay to have those difficult conversations with everybody or just a close friend. And the fact that she couldn't do that with us as family and her closest friends, that was pretty surprising at that time. So my hope is just to increase the ability for people to speak up and share what's going on.
So what do you want people to know the most about Kayla?
Kayla loved waking up for sunrises. She loved sunsets. She loved sunflowers. She loved her 2 kids. She was actually planning her wedding. She was supposed to get married this October. She cared about everyone, and it's in my hope and carrying on her memory that we make sure that we take this whole bridge approach forward with these short-term and long-term barriers to protect everyone from getting to that point where you hit a point in your life where you're feeling lost and you don't know where to go. And when you're at that point and you get to a location, you have something there that is going to stop what you're doing and make you rethink why you have everything to live for. And it gives you that time to shake you out of that I'm feeling lost. You've got that time to have those deterrents there, to have somebody approach you and say, are you okay? Can I help you? Because if those things have been in place at that time for Kayla, she'd still be here with us today. And that's my hope. Get those things up so that nobody else suffers a loss like we have. Let's get out there and protect everyone.
MJ, this has been a journey for everyone and for us. I will say the entire team here at SAVE. It has been a privilege and an honor to work alongside you with this and to be able to have you do a lot of the block and tackling and be the one that shares your voice and in your heart. And we remain committed to making this happen. We will get this done. We are not shrinking violets. We're bright yellow sunflowers. And we will make sure that this happens. This will get done. We will work with those who have the ability to make this happen to ensure that it gets done. And then we will continue to focus on other places across the state and anywhere else across the country where this kind of work needs to be done to help protect lives. So as we end this conversation today, as I've tried to end with everyone, I want you to kind of think about what is a powerful message of hope that you want to leave people with as we end this conversation.
Check in with somebody you haven't checked in the last day or two and make sure that they're doing okay, and reach out Even if you hadn't talked to them, in the last, 24 hours, reach out, check in. It could be that point in their life where they're needing you more than and make that call, make it happen, go out and save a life.
Well said. We will continue to work with you to save lives. MJ, thank you for your time here today. Thank you for all you've done to help raise awareness on this issue, and we will continue the fight.
Thank you. Appreciate
right.
you.
Have a good day. Bye-bye.
Yep.